insulin resistance, and she's going to end up with diabetes if she doesn't do something, because you can see it in her skin. So that's how significant this is for our children. And now you can look at these maps. We've got these maps everywhere, so they show you what it was like before and the increasing. We have to come up with new colors. Every time we make this map of now 2/3 of adults being overweight or obese, and on the other side, diabetes. Those yellow states now, 10% of the adult population has diabetes. And when we look across the world, it's not just us. It is everywhere. So worldwide, we're looking at soon over 300 million people with diabetes on the planet. You know, the good news for me is I'm in a growth industry. I don't have to worry about job security. The bad news is this may well collapse India's economy. And we're watching, we're tracking with the World Health Organization and a number of other entities of as their income comes up, the percent they're spending on health care is astronomically going up too. Of course, the Indian government could decide not to treat these people, let them die in the streets. But they're obviously trying to meet the needs of their population, and they don't know how to do it with what is happening. So, you know, what is diabetes? Diabetes, the hallmark of diabetes is you can't control a major factor in your blood, sugar. So the level goes too high, and that's a hallmark. We diagnose diabetes because the blood sugar is elevated outside the normal range. And what does that to you? There's two kinds of diabetes. Type 1, which mainly occurs in children, is due to genes and the environment. But now the environment is probably about infections and maybe about some triggers in our food. All of us are exposed to that environmental change. None of us can prevent type 1 diabetes. The immune system turns against the own insulin-producing tissue of the pancreas, destroys it, and those people must take insulin shots every day to survive. Type 2 diabetes, of which 90% is associated with overweight or obesity, and type 2 diabetes accounts for 90% of the diabetes in our country, and actually even more around the world. And now it's not that insulin is not being made, it's that our body cells can't respond normally to it, mainly because of this fat mass, just right there like a big cushion, secreting things that interfere in our cells with how insulin works. And you can take pills. Most people eventually will need to take insulin to manage their diabetes. And if you get type 2 diabetes, on average, you got 12 years cut off your life. And you have a chance, if you don't control this disease, to live with tremendous complications. So what does all this mean? Here's a shape of somebody who gets type 2 diabetes. The leading indicator is obesity. 1/3 of our children and 2/3 of our adults are there. Family history means a lot. And then actually what happens to you when you're in utero means a lot. So if your mother gets diabetes while she's pregnant, something we call gestational diabetes, or now it turns out if the woman just gains too much weight, that sets up a different intrauterine environment that makes that child more susceptible to becoming obese and also developing type 2 diabetes. So it's a cycle that we can't break until we fundamentally change the way people live their lives. Then you go from obesity to insulin not working in your body, and then you get to this point, before you get diabetes, you actually have something called prediabetes. Right now, there are 50 million Americans with prediabetes, most of whom are overweight or obese, and the blood sugar is starting to rise. It's not all the way high enough to make the diagnosis of diabetes, but it's not in the normal range either. About 10 to 15% of these 50 million people convert every year to developing diabetes. And then what happens? So then you get diabetes, and 21 million Americans we think now have diabetes. We don't do a good job of managing diabetes, because what happens is lifestyle, which kind of got you there in the first place, or certainly contributed, now lifestyle makes a big difference, whether you could reverse it at the beginning and you could actually have it resolve, or whether you can manage your blood sugar, manage your blood pressure, manage your blood cholesterol, or not. Because if you don't change anything and you just eat and don't have any physical activity and you're still as unfit and obese as you were when you got diabetes, then you're not going to live well with diabetes. You're not going to be able to manage this disease, and you're going to have an early cardiovascular event, and you run the risk of becoming blind, amputated, and a kidney failure. And it turns out that only about 1/3 of people with diabetes can actually control it. And why? Because they don't change their lifestyle. So the fact that you could impact on somebody diagnosed with diabetes is so incredible. That your message, that your coaching, that your lifestyle change approach will have the biggest bang for the buck in preventing and helping manage diabetes. Because if you manage diabetes, those terrible things don't have to happen to you. It's only when you don't manage it. And only 7% of people with diabetes actually can control the major things that we know lead to the problems of their blood pressure, their blood cholesterol, and their blood sugar. So that leads to 250,000 deaths a year and costs $175 billion. You know, I'm not really good with money, but I could tell you there's a lot of better things we could have spent $175 billion on than having a diabetes epidemic. So here's the cardiovascular disease. Here's what happens to the eye. The back of the eye deteriorates when you have diabetes. You can end up in kidney failure, and you can end up so that you don't have normal circulation. We have to start cutting off a toe, and then a part of a foot, and then a leg, and people end up amputated. Now this is what I want to kind of end with. So diabetes, I hope I convinced you, is a scourge. But we know how to prevent it. There is no doubt there has been the most incredible scientific study done on the prevention of type 2 diabetes. Across the country, centers enrolled people who were in that pre-diabetes range, those 50 million Americans who are overweight and already have some elevation of the blood sugar. And they entered them in a randomized trial, so nobody knows which group they're going to get. One group got nothing, one group got medication, and one group got lifestyle. What did they get when they got lifestyle? What were they given? A coach. And what did that coach do? That coach met with them. That coach got them physically active. That coach got them a better nutrition plan. That coach got them to lose weight. But that coach didn't convert them into Johnny Atlas. That coach got them to make moderate changes. Simple, one step at a time kind of changes. And I don't know if you can really appreciate this, and this is the progression over time to diabetes. So the lifestyle change had a near 60% reduction in people progressing to diabetes. Better than medication, only had a 30% reduction. And you know, medication doesn't come without complications. Of course, we had a few complications in the lifestyle change thing. Some people broke their legs. Some people, a couple people walked out in the middle of the street. So, we got to do lifestyle responsibly, but they're not the same kind of complications. When we first started this trial, we were using a new medication. I don't know if you remember Resolin, great medication, looked like it had tremendous hope. It killed people. So we had to take it off the market. So medication isn't like lifestyle. Medication doesn't make you feel as good as lifestyle. So what do these people achieve? So here's the placebo group, remarkably staying weight neutral over almost 3 years because they were in a program. Here's the lifestyle group, lost weight, little bit, coming back, but sustained a significant difference between their weight and the placebo group. And how did they do that? What was achieved? Just a 7% body weight loss, greater than 7%. It wasn't they had to lose, 100 pounds. They just had to lose 7%, change calories, and what was the most important? All they had to do was walk 30 minutes 5 times a week. The more they did, the better they did. The more they lost,